vitamin D deficiency is a major problem in patients with chronic kidney disease, CKD, at different stages, from stage 1 to stage 5. With patients with chronic kidney disease in early stages or advanced renal failure. So it's very important to check for 25D levels in our population and to replace with native or natural vitamin D to have the same values that normal population have on vitamin D levels, up than 30 nanograms. Usually, we use cholecalciferol as natural vitamin D to treat deficiency of this hormone. At the same time, we look at metabolites such as calcium, phosphate, alkaline phosphatase, and hormones such as PTH, parathyroid hormone. And in early stages of chronic kidney disease, the supplementation with vitamin D can increase 25D levels and reduce by 30 to 40% serum PTH levels with no modifications in serum calcium levels, in serum phosphate levels, and also in urinary calcium and phosphate levels. Why this is important? This is important because our population is affected by bone disease and have major cardiovascular risk factors and cardiovascular morbidity and mortality. There are many studies that demonstrate that patients with chronic kidney disease take advantage when 25D levels are normal when we treat with cholecalciferol. So CKD patients is a population that needs vitamin D. During the last months, the emergency with the COVID-19 in our hospitals was really dramatic. We had many patients with pneumonia, lung disease, infections, but also the kidneys are tissues, organs that can be affected by COVID-19. For several reasons, these patients need particular attention for the nutritional point of view. And we started to check from the very beginning our population for 25D levels. And we found very low levels of 25D in patients with COVID-19 infection that are in beds in the hospital and also have chronic kidney disease. So we started to treat with high dose of cholecalciferol those patients. And our first impression in collecting data is that patients that needs a ventilatory system to protect respiratory tract are those patients that have lower levels of 25D, which we need to use higher dosage of cholecalciferol. And we are follow the signs and the symptoms of COVID-19 patients with the low levels of 25D and follow if they can improve for some reason during the therapy that we are performing, also with the support of 25D. There are many studies that demonstrate that 25D levels when are low associated with the inflammation and the immunological disorder. So if the second step of COVID-19 infection is an immunological disease, I believe that giving vitamin D can improve also, for some aspect, the inflammation state of those patients. So this is why we are suggesting to check for 25D levels in COVID-19 patients with kidney impairment, and we can use cholecalciferol because it's a safe therapy with no side effects.